Hello students. So in today's lecture we are going to study about the metabolic disorders, and in this topic we will see lysosomal storage diseases. So there are different types and in today's lecture we will see that Gaucher disease, and in that we are going to study about the molecular basis, and then we will see about that treatment and prevention of this Gaucher disease. So friends, this today's lecture is useful for those students who are preparing for CSIR NET JRF exam in life sciences, and at the same time these are useful for those students who are preparing for that state eligibility test, or it is also called as SLATE. So it is useful to all such students. So let's start this lysosomal storage diseases, and in that we will see that Gaucher disease. So here, before going further, so all of you know that lysosomes, these are also called as the suicide bags, and these are present inside the cell, which plays the very important role in the digestion of large molecules. At the same time, if that bacteria they are entering inside the cell, that can be digested by these lysosomes or the enzymes which are present in lysosomes. So these lysosomal enzymes, they plays the very important role in the digestion of such large molecules, and that's why these lysosomes, these are called as suicide bags. So here we are going to study that lysosomal storage diseases, which are a group of about 50 rare inherited metabolic disorders. So this is one of the important or rare metabolic disorder, and that can result due to the defects in the lysosomal function. That is, if that lysosomes they are not performing their function normally, then these defects in lysosomal function, it leads to the 50 different types of rare inherited metabolic disorders, which are called as lysosomal storage diseases. So whatever this digestion of that larger molecules which can be carried by these enzymes present in the lysosomes, so there are many enzymes which are involved in this digestion process here. But if one of these enzymes is defective due to the mutation of the gene which is responsible for the formation of that particular enzyme, then these larger molecules that cannot be digested, and if there is no digestion, so such larger molecules they get accumulated within the cell, and that results into the killing of that particular cells. So that's why it is very important to function normally by that lysosomes and later on by that enzymes. If disorders or that diseases, these are caused due to the lysosomal dysfunctioning, and that is due to the consequence, or it is due to the result of deficiency of particular enzyme, because all these enzymes, these are required for the metabolism of lipids, these are required for the normal metabolism of glycoproteins. At the same time, these are required for the metabolism of mucopolysaccharides. So all these, that is lipids, glycoproteins and mucopolysaccharides, these are digested by the enzymes present in lysosomes. But if any one of these enzymes is defective, or if it is not produced, or if that lysosomal function is not normal, or if it is not functioning, then there is a disturbances in metabolism of these lipids, glycoproteins and mucopolysaccharides occurs, and that leads to the different types of lysosomal storage diseases. So here, see, this is the phagocytic cell we can see here, or that particular cell. Now this diagram, it indicates the normal functioning of the lysosomes here. See, this is the cellular material which enters inside the cell by a process called as endocytosis. So this after endocytosis, when these cell material enter that cellular material, or that particular bacterial cells for example, or microorganisms, now when they enter inside the lysosomes for example here, so there is a large number of lysosomal enzymes are present here, and that's why we can call that lysosomes as a suicide bags here. So these enzymes they break down that cellular material into smaller particles or fragments here, which can goes to the recycling of that cellular material, or sometimes it is eliminated from that particular cell. So this is actually a normal functioning of the lysosome. But when that lysosomes, they are not functioning normally or properly, at that time, as I told earlier, it leads to the lysosomal storage diseases here. See here, see this is the cellular material again here, and normally there is a breakdown of that cellular material takes place if that enzymes they are secreted or produced normally, or if they are functioning properly. At that time there is a breakdown of that cellular material takes place. But if that lysosomal functioning is not normal, then there is no breakdown of that cellular material occurs. There is no breakdown of that cellular material occurs. So we can say that that lysosome is defective. So if there is no digestion of that cellular material, so that's why there is no elimination of this material here, or there is no recycling of that material. See here, there is a elimination of that material takes place, digested material, and at the same time there is a recycling of that digested material takes place in normal lysosomes. But in lysosomes which are not functioning properly, there is no recycling, there is no digestion or breakdown, and there is no elimination of that material here. And that's why that cellular material or that lysosomes, they get accumulated inside the cells here, and that causes the killing of cells. So there is a accumulation of that substrate material here, and that causes damage to the tissues or organs, and there is the occurrence of different types of symptoms here. This is the difference between normal lysosomes and the diseased lysosomes, or we can say that here non-functioning lysosomes. Now see this diagram, it explains about the different types of lysosomal storage diseases here. So see here lipid storage here, including sphingomyelin and cholesterol accumulation, and that can lead to the, or it results into the gene mutation which is called as SMPD1. So this gene mutation in this gene here, it causes the deficiency of sphingomyelinase enzyme, and this deficiency of sphingomyelinase enzyme, it causes the one disease which is called as, it is also a metabolic disorder. It is known as Niemann-Pick disease type A and type B. So this is due to the deficiency of this sphingomyelinase activity or sphingomyelinase enzyme deficiency. So later on, if there is a mutation takes place in NPC1 and NPC2 genes, so that causes the impairment in cellular processing and transport of low density lipids, or which are known as LDL cholesterol. So there is no transportation, or there is no cellular processing of this LDL cholesterol because of these mutations in NPC1 and NPC2, and that also leads to that Niemann-Pick disease type C. Okay, so these are also the lipid storage disease or lysosomal storage disease here. So these are the lysosomes here, all these are the lysosomes here. Later on there is the glycogen storage disease is also there here. See here, acid alpha glucosidase or acid maltase deficiency, and if there is a deficiency of this enzyme, then it leads to the Pompe disease. Or here there is a, for example here, glycolipid storage, for example this glucocerebrosidase deficiency. So that is the deficiency of this enzyme, it is responsible for the Gaucher disease that we are going to see here. See, this is glucocerebrosidase deficiency, and if there is a deficiency of this enzyme, that leads to the Gaucher disease that we are going to study here. So this is also a metabolic disorder. Then glycosphingolipid storage, that is there is a deficiency of alpha galactosidase A. So this deficiency of alpha galactosidase A enzyme, it leads to the Fabry disease. Then later on, these are the different types of metabolic disorders here, that are caused due to the deficiency of particular enzyme here. For example, this alpha L iduronidase deficiency, it leads to the mucopolysaccharidosis 1. Then iduronate sulfatase deficiency, it leads to the mucopolysaccharidosis 2. Or there is a heparan sulfamidase deficiency, then it causes mucopolysaccharidosis 3A. So there are different types of that metabolic disorders here, and all these disorders, these are caused due to the deficiency of particular enzyme which are required for the normal metabolism. So all these metabolic disorders, these are caused due to the mutation in that particular gene. For example, here that deficiency of gene or that chromosome 1, it leads to the Gaucher disease here, that we will see later on. So these are the different types of lysosomal storage diseases. So this is the another table here which also explains the different types of lysosomal storage diseases here, or metabolic disorders. All these are metabolic disorders here. For example, the name, this is first column includes the name of diseases here. Then in second column there is a defective protein or that enzyme. Then that materials which get accumulated here because of deficiency of such enzymes. Then the organ systems which are affected by deficiency of that particular enzymes, and whether there is the involvement of that central nervous system, that is in last column here. For example, here Fabry disease, it is due to the deficiency of alpha galactosidase A, and the material or molecules which get accumulated, that includes, that is globotriacylceramide and blood group B substances. And the organ systems which are involved here, that includes kidney as well as heart, and it is also causes the defects or the damage to the central nervous system here. So there is a involvement of central nervous system in this disease here. Then second disease today we are going to see that is Gaucher disease. The defective protein or deficiency enzyme is here beta glucosidase here, and the materials which get accumulated, that includes glucosylceramide or glucosylsphingosine. And the organs which are affected by this Gaucher disease, that includes spleen, liver and bone marrow. And there is a involvement of or damage to the central nervous system takes place, but in case of type 2 Gaucher disease and type 3 Gaucher disease, because there are three different types of Gaucher diseases are there, and that includes type 1, type 2 and type 3. Then Niemann-Pick A and B disease. The defective enzyme is here or deficiency enzyme is here, that is called as sphingomyelinase, and the materials which get accumulated because of deficiency of this enzyme, that includes sphingomyelin, and the organs which are affected here, that includes spleen, liver, bone marrow, lung, and that is in type B. And here there is a damage to the central nervous system takes place, but in case of type A, Niemann-Pick disease here. Then later on, this GM1 gangliosidosis, and the deficiency enzyme is here, that is beta galactosidase, and the materials which get accumulated inside the cell or in lysosomes, that includes GM1 ganglioside, and the organ system which is affected here, that includes skeleton and heart, and it also causes damage to the central nervous system. So this is about the sphingolipids, and later on there is some mucopolysaccharides are also there, the metabolism of which get affected due to the deficiency of these different enzymes here. So in this way, there is a different types of enzymes which are required for the metabolism, but that get affected because of deficiency of that different enzymes here. And deficiency of different enzymes, that leads to the that metabolic disorders here. So these are the metabolic, that is deficient enzymes here, and all these are the different types of metabolic disorders which are caused due to the deficiency of that particular enzyme. So later on, so the next slide we will see here, that is, now we will start actual our topic, today's topic here, and that is nothing but the Gaucher disease. So what is this Gaucher disease? So already I have told here that Gaucher disease, it is a lysosomal storage disease. It is a lysosomal storage disease, and it is the most common disease here of that lysosomes. Then this Gaucher disease, it is caused due to the failure of lysosomes to degrade the particular substances here. And in this case, the substance means it is nothing but the beta glucosidase, or the substance it is nothing but the glucocerebrosidase. So there is a deficiency of this enzyme, sidase enzyme is here, glucocerebrosidase, and that leads to the Gaucher disease here. Then these non-degraded, if there is a deficiency of that enzyme is there, then that can lead to the accumulation of that substances. So that substances does not get degraded, and therefore these get accumulated inside the cell, and that already naturally, or it results into the increase in the size as well as number of lysosomes within the cell, which leads to the malfunctioning of that lysosomes or that enzyme, and later on it causes the defect in that particular organs here. So in this way, Then later on, mainly this Gaucher disease, it is found in Jewish population here, and the frequency of occurrence of this disease is 1 in 2500 individuals. That is nothing but one person, or we can say individual, it is suffering from this Gaucher disease out of 2500 individuals here, and mostly it is common in Jewish population or pupils here. Now this disease, it is caused due to the recessive mutation. So as I already told here, there is a mutation in genes takes place, and that leads to the defective enzyme, or it causes the deficiency of that particular enzyme here. So in case of this Gaucher disease, there is a mutation takes place in this GBA gene, which is present on the chromosome 1. So this Gaucher disease, it is related to the mutation or mutation in GBA gene of chromosome 1, and it affects the both males as well as females. That Gaucher disease, it is occurring both females as well as males, and about 100 people in the United States are carriers of the most common types of this Gaucher disease, and the carrier rate among the Jews is 8.9%, and while the birth incidence, it is about 450. Then this Gaucher disease, it is the most common, as I already told in previous slide, it is the most common lysosomal storage disease here. Here I also told here, it is the most common lysosomal storage disease, and it is form of sphingolipidosis, which is a subgroup of lysosomal storage diseases, and it involves the dysfunctional metabolism of sphingolipids here. Now the name of this disease is given after the French physician, that is Philippe Gaucher. So that Philippe Gaucher, he described this disease in 1882. That's why this disease is called as Gaucher disease. See, these are the types of Gaucher disease here. So this is our next point, that is the types of Gaucher disease. So here, as I already told, there are three different types of Gaucher diseases. One is type 1 Gaucher disease, then type 2, then type 3. So there are three different types of Gaucher diseases. See here, comparison is given. For example, onset of disease. Now this type 1, it is occurs in childhood as well as in adulthood. Then type 2, it is occurred in infants, and type 3, it is occurred in childhood or in adolescence children here. Then age at death, there is also death takes place in some that Gaucher diseases here. Now in case of type 1, the death can take place at the childhood or that adulthood. Then in type 2, the death can occur median 9 months here or up to 9 months, and in case of type 3, the death can occur in childhood or in early adulthood. Then these are the symptoms here, that is there is a hepatosplenomegaly, or you can say differently here, hepatomegaly or splenomegaly. Hepatomegaly means here there is a swelling of liver, and splenomegaly means here there is a swelling of spleen. So there is a hepatosplenomegaly. It is present in all types of Gaucher diseases here. That is, this swelling of liver and spleen occurs in case of type 1, type 2 as well as type 3 Gaucher diseases here. Okay. So there is a bone involvement. It is present in type 1, but it is absent in type 2, and again it is present in type 3 here. Then neurodegeneration, that is nothing but there is a degeneration or there is a damage to the central nervous system takes place here, or nervous system occurs. That neurodegeneration, it is absent in type 1 Gaucher disease, but it is present in type 2 and type 3. So that both of these Gaucher disease, that is type 2 and type 3, there is a neurodegeneration takes place here. And other systems which are involved in this Gaucher disease, in type 1 there is the involvement of that hepatic fibrosis is there, then pulmonary disease function is also there, hypertension is there, then lymphoma is there, pancreatic, and so these are the different symptoms here we can see here. Then congenital ichthyosis, then cardiac and vascular calcification, which can take or occurs in the type 3 Gaucher disease. So these are the mutations associated with this Gaucher diseases here. So in case of type 1, that mutation takes place in the gene N37OS, then it is different genes are affected or mutated, and in type 3, that mutation takes place in the L444P. So this is about the types of Gaucher disease. See here, that symptoms of the type 1. It is also called as actually non-neuropathic because there is no involvement of central nervous system or that nervous system here. So this is type 1 Gaucher disease, and the symptoms include splenomegaly. Splenomegaly and hepatomegaly means here, splenomegaly means here that is nothing but there is a swelling of spleen. So there is a swelling of spleen, and hepatomegaly means here there is a swelling of liver. There is a swelling of liver here. So there is a bone diseases also occurs. Then thrombocytopenia means here there is a decrease in the count of that thrombocytes or platelets. So that is called as thrombocytopenia. Then it also causes the anemia. Then there is a retardation of growth. Then bleeding or bruising. Then it leads to the fatigue. Then bone pain or crisis, and abdominal pain is also there. So all these are the symptoms of type 1 Gaucher disease, and this is the children who is suffering from this type 1 Gaucher disease. And here we can observe here there is a swelling of that liver as well as that spleen here inside the body. So this is the type 1 Gaucher disease. Now see, these are the again another symptoms in adults also here. So there is the involvement of pulmonary system. So later on there is a moderate hepatomegaly, that is nothing but the swelling of liver here. So this is the liver here, these are the lungs here because related to the pulmonary system here. Then there is a splenomegaly, that is nothing but the swelling of spleen here. See, this hepatomegaly or swelling of liver, it is occurs in 54% that individuals who are affected by this type 1 Gaucher disease. Then splenomegaly, then later on there is a progressive neurologic symptoms here also occurs. Then later on anemia, then moderate to severe thrombocytopenia, it is occurs in 60% individuals who are suffering from Gaucher 1 or type 1 disease. Then there is a bone pain, then bone crisis, and there is also radiological evidences are there regarding that bone disease here, and that is in 83 persons who are suffering from this type 1 Gaucher disease. So these are the symptoms of Gaucher type 1. Then later on symptoms of Gaucher type 2 disease, and that type 2 includes the brain damage also here takes place in type 2. So there is a brain damage also occurs in type 2 Gaucher disease here, and that is severe as well as rapidly worsening or progressing brain damage takes place here. And the other symptoms or signs includes there is a poor development, then there is a scissoring, then spasticity is also there, that is nothing but the jerking movements here, then poor ability to suck and swallow, and there is also enlargement of liver as well as spleen. That is nothing but there is a, we can see here, there is a occurrence of hepatomegaly and splenomegaly. So these are the symptoms of Gaucher disease type 2. Next one is here Gaucher disease type 3 symptoms. So these are the symptoms of Gaucher disease type 3, and that includes seizures, then there is a skeletal irregularities, then there is a eye movement disorders, then there is a cognitive problems or there is a defects in the cognitive behavior, then there is a poor coordination, then here also there is an enlargement of liver and spleen, that is hepatomegaly and splenomegaly. It also causes some respiratory problems, and it also leads to the blood disorders or blood related diseases here. So these are the symptoms of Gaucher disease type 3. Now see here, now next point we will see, that is the molecular and cellular basis of Gaucher disease. So how there is a occurrence of this disease in individuals, that may be children or that adults here. So see, this is the normal mechanism I have shown here. So this is the waste material which is outside the cell, or damage we can say, damaged material, or that microorganisms we can see here, or pathogens we can say. So these macrophages, they engulf or they swallows this waste material. So there is a swallowing of this foreign material takes place, and now that material enters inside the phagocytic cell or macrophages here. So and it forms a lysosome containing waste material. Now here that waste material, it is ingested by lysosomes or phagosomes, which combines with lysosome later on, and which leads to the phagolysosome. So now that waste material, it is inside the lysosomes here. So when there is a normal activity of that lysosome takes place here, so that waste material, it is degraded and it is expelled or it is removed from the cell. or it is recycled in case of normal activity here. But if there is a Gaucher disease is there, if that particular individual is suffering from Gaucher disease, that means there is a lack of enzymes or that particular enzymes here, and so that's why it leads to that accumulation of that waste material inside the lysosomes here. So that glucocerebrosidase enzyme, if it is deficient because of this Gaucher disease, so that lack of that glucocerebrosidase enzyme, it does not metabolize that cellular material or that waste material, and that's why that waste material it get accumulated inside the cell or inside the lysosomes here. So that's why, or it leads to the killing of cells. So this is the dysfunctioning of that lysosomes in case of that Gaucher disease, or when that particular individual is suffering from Gaucher disease. See, this is the actual metabolism here. See here, glycosphingolipids here, which get converted to that is glucosylceramide, and in case of normal metabolism, that glucosylceramide it get metabolized into glucose and ceramide if there is a presence of this glucocerebrosidase enzyme. If there is a presence of this glucocerebrosidase enzyme is there, then there is a normal metabolism of this glucosylceramide takes place, which leads to the formation of glucose and ceramide. This is the normal metabolism. But if there is a deficiency of that glucocerebrosidase enzyme in case of that Gaucher disease patient, so at that time this glucocerebrosidase enzyme it is not produced, or there is a deficiency of these enzymes, and that's why there is no metabolism takes place. If there is no metabolism of this glucosylceramide, so this waste material or this glucosylceramide it get accumulated inside the cell or inside the lysosomes, and that's why this accumulation of that material or that glucosylceramide that kills the cells here. So that is the Gaucher disease. That is nothing but it is a metabolic disorder. So this is about the Gaucher disease that we have seen up to here, symptoms of type 1, type 2 and type 3. Next point is here, treatment of Gaucher disease. How it can be treated. What is the treatment for that Gaucher disease? So the current treatment which is available for the Gaucher disease, it includes the one is enzyme replacement therapy, that is nothing but ERT, and the second one is here substrate reduction therapy. So in first one, that is in enzyme replacement therapy, there is a introduction of that enzyme. Which is that enzyme? This glucocerebrosidase, because that disease, Gaucher disease, it is due to the deficiency of enzyme. So if you introduce that enzyme, that is glucocerebrosidase enzyme in patient, so that will be the treatment for this Gaucher disease. And in second case, because that enzyme is not available in that patient, or there is a deficiency of that enzyme, so we can reduce that substrate here. We can reduce that substrate. Substrate means here this one, that is glucosylceramide. So that can be reduced, and this is one of the aspect for the Gaucher disease treatment here. So these are the two important treatment for Gaucher disease. One is enzyme replacement therapy, and second one is here substrate reduction therapy. So first we will see enzyme replacement therapy. So that enzyme replacement therapy, it includes or it involves the intravenous infusions. So it involves the intravenous infusions of this enzyme to correct the enzyme deficiency which causes the symptoms of Gaucher disease. So there is a intravenous infusion is given to that patient, and that infusion it is of that enzyme which is called as glucocerebrosidase enzyme here. So that's why, so this enzyme replacement therapy, it balances low levels of glucocerebrosidase because there is a deficiency of this enzyme. But when there is an introduction or infusion or intravenous infusion of this glucocerebrosidase enzyme in patient, so that can balances the levels of that enzyme in patient's body, and this enzyme it is the modified version of the original enzyme here. And we know the functioning of that enzyme, and that is nothing but this enzyme it breaks the glucocerebroside, the fatty compound or chemical which get accumulated in the body of patients who are suffering from the Gaucher disease. So in that patients there is an accumulation of this compound takes place here, and that's why it is very essential to bring breakdown of this substance. So it get recycled or it removed from the cell, and that's why there is a enzyme replacement therapy works. So that patients who receive this enzyme replacement therapy via intravenous infusion, it takes usually 1 to 2 hours, and that patients they need and this enzyme replacement therapy infusion in every 2 weeks here. So after every 2 weeks, it is very essential to give this intravenous infusion of this glucocerebrosidase enzyme to that patients suffering from this Gaucher disease here. And this Food and Drug Administration or FDA, it has approved that enzyme replacement therapy treatments for Gaucher disease, including the different drugs here. For example, one is Cerizime, that is called as imiglycerase, then VPRIV, that is velaglycerase alpha, and Lyso, that is called as taliglycerase alpha. So these are the FDA approved drugs which are used for the treatment of that Gaucher disease and which are the part of enzyme replacement therapy. Second treatment for Gaucher disease is here substrate reduction therapy, because that substrate get accumulated here in case of patients suffering from the Gaucher disease. So it is one object to reduce that substrate here, and therefore in case of this substrate reduction therapy, instead of restoring the low levels of that enzyme, that is glucocerebrosidase enzyme, that there is a substrate reduction therapy reduces the amount of that glucocerebroside which are produced by the body. So there is a decrease in quantity of this or concentration of this glucocerebroside. That means we are reducing the substrate. So that's why it is called as substrate reduction therapy. And this process, it decreases the work of the body's enzyme which must do by giving its less glucocerebroside to break down, because that substrate is reducing here. And that substrate reduction therapy, it is the oral medications here. Okay. So there are currently 2 FDA or Food and Drug Administration approved oral that substrate reduction drugs are available for patients with Gaucher disease, and that includes, that is Sardelga, that is Eliglustat, and Zavesca, that is Miglustat. So these 2 drugs or substrate reduction therapy, these are available for certain patients only, because there are some complications will occur in some patients, and that's why for example here, that substrate reduction therapies, these are not approved for use in people who are under 18 years old. At the same time, these are not approved for women who are breastfeeding or who are pregnant or they are trying to become pregnant. So in such persons or individuals, this substrate reduction therapy, it cannot be done. And this substrate reduction therapy, it partially blocks the body from producing the glucocerebroside. So if there is a blocking of production of this glucocerebroside, automatically there is a reduction of that substrate will takes place here. And this, so therefore, so it get, now the drugs, it works differently from enzyme replacement therapy for which is used for this Gaucher disease, because that enzyme replacement therapy, it breaks that glucocerebroside here, and that substrate reduction therapy, it inhibits the formation of glucocerebroside. So this is the difference between that enzyme replacement therapy and this substrate reduction therapy. So how that Gaucher disease is inherited, or how this Gaucher disease it get transmitted from parents to their progenies. So this Gaucher disease, it is a autosomal recessive disorder. Gaucher disease, it is a autosomal recessive disorder. It means the person must receive the Gaucher gene from both of the parents in order to occur that particular disease. Because if that both parents they are having that Gaucher gene in their bodies, and if that genes from both parents it get transmitted to the progenies or offsprings, then that progenies that can suffer from this Gaucher disease. And most genes they exist in pairs, and one coming from the mother and one coming from the, or another coming from the father. And when one Gaucher gene in the pair is abnormal, now there is a 2 genes are present for example here, and if one gene is abnormal, then the child is an asymptomatic carrier. that is nothing but that children, it will become carrier for this Gaucher genes or that disease, but it is asymptomatic or it does not show any symptoms, and it can pass that abnormal gene to his or her children, that is to the next generation here. And if both genes in the pair are defective, if both genes, we have seen here, if one gene Gaucher gene in the pair is abnormal or defective, then the child, it is asymptomatic carrier, but it can pass that abnormal gene to the children or to the next generation here. And if both genes are defective, then the person will suffer from Gaucher disease, or that person will have that Gaucher disease. So what does this mean for the parent who has Gaucher disease? So in case of, so if one partner or one parent or partner does not have the Gaucher gene, so each of children, they will be carriers. So whatever the children they will have, none of the children they will suffer from this Gaucher disease, but they will be carrier for this Gaucher disease gene, if one partner does not have the Gaucher gene. Second, if one partner is carrier of the Gaucher gene, then each child will have a 50% chance of having Gaucher disease and remaining 50% chance of being a carrier. Okay, and if both partner or both parents they have Gaucher disease or they have Gaucher gene, then each of their children they will suffer from this Gaucher disease. So in this way, that Gaucher disease can be inherited or can be transmitted to the next generation. See, this is the diagram which shows how that Gaucher disease get transmitted to the next generation. For here, in this case here, see, there are different colors are used here. For example, this color, it indicates carrier, means here this is a carrier here. I will write here C. Then this blue color, dark blue color, this is the individuals who are suffering from Gaucher disease, and these colors, this one gray color, these are the individuals which are unaffected. Okay, so if there is a marriage takes place between that persons who is a carrier and another one is unaffected. So in such parents, the progenies will be, so 50% progenies are unaffected and 50% progenies will be carrier here. Then in case of such parents here or progenies, that is, one is suffering from Gaucher disease and another one is unaffected. So in such parents and their progenies, so all these progenies they have carrier, or that is they are carrier or they have the genes here, but these are asymptomatic. If there is a marriage takes place between two carrier individuals here, carrier for that Gaucher disease, then in such case one progeny will suffer from this Gaucher disease here. Then one will be, that is we can say here 20% progenies they will suffer from Gaucher disease, then 50% progenies that will be carrier, and that 25% that will be unaffected here. So here in this case that progenies will be like this. And in last case here, if one parent is suffering from Gaucher disease and another one is carrier, so in such cases that 50% progenies, so 50% progenies they will affected by this Gaucher disease, and that 50% progenies they will carrier for this Gaucher disease. So these are the chart which shows how that Gaucher disease get transmitted to the next generation here. So which genetic mutations are most severe in case of this Gaucher disease here? So that different scientists they have identified more than 4,000 genetic mutations which are associated with this Gaucher disease, and there are some scientists which are identified about genetic mutations associated with the Gaucher disease, and that includes that 2 copies of the gene, that is L444P mutation, which causes the neurological symptoms, and these are related to the Gaucher disease type 2 and type 3. So this is the gene in which that mutation takes place here. Then patients with 1 copy of this N370S mutation, so and plus another mutation that have the Gaucher disease type 1. So we can say here that this mutation in L444P, it is related to the Gaucher disease type 2 and type 3, and mutation in N370S, that is related to the Gaucher disease type 1 here. So patients with 2 copies of the, that is N370S mutation, they have a milder form of Gaucher disease, that people with one copy here. If there is two copies are there, then that Gaucher disease will be more severe, and if there is a one copy is there, then it will be mild. So it will be milder Gaucher disease here, or that disease will be mild here, or having not much severe symptoms here. So here we have finished this Gaucher disease, in which we have completed about the basics about that Gaucher disease, and then we have studied about the treatment for that Gaucher disease and genetics, or how that disease can be transmitted to the next generation. So friends, in future I am also uploading the such type of video lectures which can be useful for those students who are preparing for CSIR, NET, JRF in life sciences. So kindly subscribe this channel so that you will get notified when I will upload that videos, or when there is a YouTube live lecture. Thank you.